Well, let's start looking at this amazing dextrose and what it does and what's been shown. We'll first look at ligaments and tendons. Dextrose causes growth or proliferation in ligament and tendon, and it can do so without inflammation. This was investigated at the Mayo Clinic. Dr. O and colleagues associated with the Department of Neurology wanted to develop a model for carpal tunnel syndrome in animals. So they wanted to make the tissue in the carpal tunnel of the rabbit grow and press on the median nerve. They observed my studies on 10% dextrose use in knee and finger arthritis and the proliferation or the growth and repair in the ACL ligament that we'll talk about later. And they chose 10% dextrose because they wanted a non-inflammatory model for carpal tunnel syndrome. What they did is they took a very tiny amount of dextrose, 10%. They did a tenth of a milliliter, and they injected that tenth of a milliliter under vision, direct vision. They made an incision and injected it right into the tissue of the tendon sheath close to the median nerve. And they wanted to grow that tissue then. And on the other side, they injected saline, normal saline, in the same area. Here's what they found. If you look on the left, that's the saline. You'll notice no dark black fibroblasts on the right. On the dextrose side, you see numerous black structures. Those are fibroblasts. And if you're a histologist, you can recognize there are no neutrophils here. The neutrophils would indicate inflammation. And very important, the doctors here did biopsies at 1, 2, 4, 8, and 12 weeks. So they wanted to pick up inflammation at any point in time, and they could not find any, despite the obvious proliferation or growth of fibroblasts.